Namaste. Good evening, everyone. Thanks for coming. मैं डॉक्टर अर्जुन बॉटकला आयुर्वेदिक मार्केटिंग डिपार्टमेंट से आपको बात कर रहा हूँ. So today you have come here for a session on Panchakarma, some clinical aspects on it, and to talk on that we already have senior doctor, Dr. TMU Varya, who is our branch manager and chief physician of our Ernakulam branch. So I wholeheartedly welcome you, sir, to this session. So please make sure that all of your mics are on mute for smooth functioning of this program. आपका mics mute पे रखने के लिए थोड़ा सा ध्यान रखना, नहीं तो थोड़ा सा प्रॉब्लम हो जाएगा. So already 3:30 हो गया है. Without further ado, I think we can start, sir. आप start कर दीजिए जी. You can start, sir. It's already
okay. Very good evening. I'll do the screen sharing. Huh? So, how is everything going on, sir? How is your practice after Corona, Omicron? Third wave is all over. Now we are having a leisure time, no? So we are expecting a fourth wave of Corona by the month of June, July. The scientists are saying like that. I don't know what will happen. During the Corona period, our practice was so bad, and later on it was picking up with all this immunity medicine, Ayush prescription, and all these things. The wonderful thing was that public accepted Ayurvedic preventive medicine. I think that is most of your experience also. All the medicines, Sudarshan Khanavati, Suddhakanta, and all these things, cortical protection, Ayush Quad, Chur, all these things as accepted by the public patients. And so many people are using, and so many people are reporting very good improvement. So Ayush is having spread and all that, they are publishing it. Say, okay, today coming to my this paper, my lecture, clinical application of some of the Panchakarma procedure. I think all of you are able to hear, no? So you people are, most of you are postgraduates in Ayurveda from various well-known universities. Some of them are chronic practitioners, BAMS practitioners. So some or other Panchakarma procedures you may be doing in your hospital or your own clinic, getting some good results also. But everybody feels that for Panchakarma, Kerala is the famous. It was. Nowadays, all over the India, postgraduate Panchakarma courses are there. Postgraduate Kaichakalsa courses are there. Everybody is well known, highly experienced in various types of Panchakarma. Vaman, Virechan, Basti, Nasya, and Daktamoksha. Vamana, most of you are doing for skin diseases, Shwasa, Kasa, Stomaka Shwasa, Kapadhiga Rogas. It's a very, nowadays, very common thing. Virechana, it is an OP level procedure. You can give simple Virechana Aushadas and get miracle result. For Basti, Kal Basti, Yoga Basti, Karma Basti, all you require to do 8 days, 15 days, 13 days procedure. Hospitalization is a must. And proper Purvakarma and Paschat Karma is a must. So without that, you will not get any proper result in Basti Karma. Nasya, again, it is an OP level procedure. Rakta Moksha, we are all doing mostly the Jalokavacharana, Prakshana, all these procedures. Serabhyada, very few people are doing. But with the syringe, so many people are doing good result in psoriasis and all other diseases. So the success of the Panchakarma lies in the Purva Karma. How thoroughly, how strictly, how beautifully you do the Purva Karma, proper Snehana Karma and proper Sweda Karma, how you are doing. The success of the Panchakarma depends upon these two procedures. So if you want a permanent, long-lasting effect of the Panchakarma, you have to do the Paschat Karma, which is Shamana and Rasayana. Of course, Shamana Aushadha we used to do, but very few people used to do the Rasayana Chikitsa. So in this thing, I am highlighting one Rasayana experience also. So, Pushpavalli madam, please don't talk. Please don't talk. If you have any doubt, kindly talk.
1 second, sir. I think they think that you are not changing the slide. He has not started changing the slides. He's just talking as okay.
Slide sharing, I have not started. This is only introductory talk. So in Kottakkal, we are doing most of the Panchakarma procedures along with the Snehana and Sweta. The patients come for 7 days program, 14 days program, 1 month program, 21 days and all these things. So within that short period, we have to do Swedan, Snehan, Swedan and the Panchakarma according to the condition. So we cannot say that first we will do 14 days Swedana Karma, Sneha Sweda, then only we will go for the Panchakarma. Because the patient may be having only 14 days. Whatever possible according to the condition. Do combine this procedure and combine the Shamana Aushadhas, Svirajana procedures. Then only we can accommodate and adjust and satisfy the patient. Nowadays, the cost of IP treatment is very, very high. Room rent and all these Panchakarma procedures are very high. So we cannot strictly say that a case requires 31 days or 40 days, 50 days hospitalized. The hospital will go up. You will not get the patient. So it has become a practice for everybody in this field of Ayurveda, especially Panchakarma hospital, that cut short the period and give a compact capsule programs. Few such cases I am going to highlight in this presentation. So there may be mistakes. Kindly I apologize. Just me. You can tell me the mistake. I am not going into the details of the dosha, dushya, sthana samshaya, and all these things in detail because it's a purely clinical class. So I'll talk only about the clinical condition. Okay. With this introduction, I am going into the slides. So one Kottakkal Ayurvedishala hospital is there in Kottakkal. Second one in Ernakulam, Kochi. A third hospital is there in Delhi, Karkaduma. Because I was working in the Delhi Cochin hospital for 10 years. So during that period, few cases I have come across with successful result I'm going to highlight. A patient came from Andhra Pradesh, Tirupati, male patient. He was having the age of 45 years old, normal build, not too obese or lean, and with a chronic low back pain. The patient was not able to stand straight. He was always in the bent position because of the chronic back pain. So he was treated in the various hospitals of the Andhra Pradesh. In the beginning, they diagnosed as a IVDP through MRI. So after later on, they diagnosed it as a serious lumbar disc degenerative changes. So history of the disease was 15 years. He was running a hotel come restaurant, and he was an agriculture resource. So he used to travel a lot in the two-wheeler in the Kacha road of village. Kacha road of village. So without much rest. So in the beginning, after MRI, IVDP was diagnosed, and he was recommended for a surgery. Lumbar surgery, lumbar laminectomy was done. Sorry for the inconvenience. Yeah, meeting land pinna parayan. So first he underwent the lumbar laminectomy surgery nearly 12 years back. Then after a few months again he developed the surgery. Again that's recommended for a second surgery after 2-3 years. And he was suffering from chronic this thing. He avoided the two-wheeler and he was using the car for the traveling and everything. And again he was suffering from the severe low back pain. And the fourth surgery was done. You won't believe that patient underwent 4 times surgery. The fourth time what they did, they fixed the lumbar area with screws and metal plates. He was having borderline diabetes and no other major issues. His digestion metabolism was absolutely normal, and he was having normal bowel movement, clear and everything. And because of all this medication, little bit weak and emaciated, that's all. Otherwise, he was quite healthy. So after the fourth surgery, he came to us and told me all this history. I told him, because already you underwent the 4 times surgery. The scope of Ayurveda treatment in this condition is very, very, very poor. If you are very serious about our treatment, then only I will recommend the treatment. Otherwise, please go back. Pratyakhyaya prasade. There is this thing in the Sadhurta, no? Pratyakhyaya. You have to tell in advance the probability, chances of cure and everything in advance, such chronic type of cases. Otherwise, the patient may be spending thousands of rupees and without getting proper result, he will scold us. He will say that we cheated him. So I told him all this thing. Then he told me frankly that I know all these things. I was treated by few Ayurvedic doctors in my village also. But I heard about Kottakkal Ayurvedishala. That's why I came to you. If you are ready, I am also. Then why not? We admitted him. So we started him with the Gandharvastadi Kashayam and Gandharvastadi Eranda as a Mrudu Virejana. Vatasyopakramas Nehas Swedas Samshodhanam Mrudu. And after 3 days of Mrudu Samshodhana, we started him with Ashtavarga Kashaya. Ashtavarga. This is not Jivaniya Ashtavarga. Balasahajareranda Shuddhirasna Suradduramai. And Dhanundara Kashaya. Reference is Ashtangradayam Shariram. Prasava Chikitsa. And same Dhanundara Yoga in the Avarti, 101 capsules are available. That we started for him from the 4th day onwards. And along with that, Kashor Gulgulu and Praval Bhasma twice after. Rasnadi Gridam and Gugulu Tiktaga Gridam. Rasnadi Gridam was supposed to be the Jankhoru Prashtatraga Parsha Shulahara. Rasnadi Gridam. And Gugulu Tikta, Panchatikta Gulu Gulu Bharashwadi, you know, all these Asti Majjagata, all these Vata Vyadis, Gugulu Tikta Gridam is very, very effective. So I thought of combining both together, Rasnadi Gridam and Gugulu Tikta Gridam together. Then we started medication, and regarding the hospitalized treatment, during the first 3 days of Madhavirejana days, Dhanyamla Thara was given for the whole body. Dhanyamla is a very good thing for the to reduce the inflammation, swelling, and pain reliever. You can say it is an Amapachana also, which is very effective. With these 3 days of Dhanyamla Dhara itself, his body become very relaxed. You won't believe, very relaxed. He was reporting that there was some improvement in the pain also, some improvement. So after 3 days of Dhanyamla Dhara, we switched over to Kaya Seka, that is Pirichal in Malayalam. 4 people used to do the oil pouring, warm oil pouring, both side, upper one, lower one, right and upper one, lower, left upper one, left lower one, left right lower one, like that. 4 people drip his body with the warm body oil. So we used Sahacharadi Kulambu, Yamaga, Dhanvandara Kulambu, Yamaga Sneha. That is for, we have done it for the 3 days. So along with that, and along with, during this Kaya Sega period, Pinda Sweda with the Dhanyamla 7 days for the low back alone. You take Pindasveda, Churna Pindasveda powder, add a little bit of Dhanyamla in that one, make a portlet of that, take Dhanyamla liquid, heat that Dhanyamla liquid, take that ball of Pinda, Churna Pinda, and dip into the Dhanyamla, warm Dhanyamla, do slight mardana of the low back, very mild mardana, because you have to be very careful in this case, because there is a steel rod and nuts. So forceful massage, everything is prohibited. So that is the second small treatment we have getting. Kaya Sega, and second Pindasveda with the Dhanyamla for 7 days. After during that period also, we have given him a low back bandage with Mahakukkuda Mamsa Taila. Mahakukkuda Mamsa Taila is reference messenger Ratnavali. It is very effective in the various types of Vata Vyadhis. Kindly refer the book. Chakradatta also it is mentioned in the Vata Vyadhi. Mahakukkuda Mamsa Taila. Those who are interested, kindly make a note of this and refer the book. So that is one time program, another program. And another thing we did was, we did a lepa with the Valiya Marma Guliga and Karutta Guliga. It is an exclusive Kotakal Ayurvedishala product. 2 tablets, Gutikas, Valiya Marma Gutika and Karutta Guliga. Both are having very good anti-inflammatory painkillers because the patient was suffering from severe pain. So these 2 tablets made into paste with hot water and applied to the lumbar area. So after 7 days of these 4 programs, we had a Virechana in after the 7 days, and again with the Gandharvastadi Erata. Then 1 or 2 days gap, and we switched over to Shastika Pinda Sweda. Shastika Pinda Sweda. Because our idea was, because there is a Vata Kshaya, Asti Dhatu Kshaya, Vata Vruddhi and Asti Dhatu Kshaya, and Shula was the main thing. We thought this will be more, Shastika Pinda Sweda will be more effective. And the Basti treatment, Madhutailika Basti. Madhutaile Same Karsha Saindavaldi Budichar Mishmudi Erenda Mulakwatena. That is the Charaka Kalpasthana and Ashtanga Kalpahridaya Kalpasthana. That is very simple Vasti Yoga. Very simple Vasti Yoga without much side effects, without much complications, according to my experience. So after the 14 days of treatment, patient was given the follow-up treatment of same medicine, Ashtavarga and Dhanvandara and all these things. Gukulutiktaga Girda was recommended for the continuous use of 3 months. Patient readmitted after 6 months and reported that there was no improvement at all. I was in a very, very bad mood that day. But patient encouraged me. Patient told me, doctor, don't worry, we will repeat the case, repeat the treatment. Then he underwent the 14 days of same course of treatment. During the 3rd time also he admitted, every 6 months he used to come. Every 6 months he used to come. 3rd time also we admitted, and patient reported the day first itself said, sorry sir, no improvement at all. Almost all the therapies and medicines were followed as such, with slight modification here and there, and I think Kashayam was changed. Instead of Hashtavarga and Dhanvandara, we switched over to Sahacharadi Kashayam and Sahacharadi 7 Avartita morning and evening. And Nastadikradam was cut, Mukulitiktakradam was alone was given. That was the change I made. And I told him, hello, sir, please don't come if you are not getting any report. He told that, yeah, I will come back. I have sufficient money. I am having very good faith in Ayurveda. I'll come back and do the treatment. You won't believe that after 6 months, the patient came back for the 4th time treatment. And he told me, actually, he was from Tirupati. That was the wonderful thing. That day morning, I was sitting in the OPD with a lot of patients. And after one or two patients, he came into my consultation room and gave me one bag. Every time when he used to come, he used to come with Tirupati laddu and give me as a prasad. So I immediately got up and I collected that bag, and I thought it is a Tirupati laddu. I opened that bag. I saw 2 metal plates, 4 metal screws in that bag. I was surprised and I was in a shock also. What is this? What is this? What happened, bhai? Am I poinde? What happened? What is this? And he was laughing at me, sir. He told me that after the 3rd time treatment, he went back and there was no improvement at all. Suddenly one day night, the pain aggravated. Purnima Riki, kindly mute. Purnima Riki, kindly mute. Okay. And because of the severity of the pain, he was admitted in the modern hospital, and the doctors took an MRI immediately. They told him that there is sufficient bone growth in that area, and better it is to remove that metal plates and everything. And they removed the metal screws and plates and everything. After removal that one, absolutely no pain at all. The 4th time, he was very, very happy. He told me that all these things is due to Ayurveda, Panchakarma treatment. I couldn't believe that one. I couldn't believe that one. But during that 14 days, not a single day he reported pain. Not a single day he reported pain. He was very, very happy. We repeated all the procedure, including the Vasti 14 days. And you won't believe, after 6 months, he came back for the 5th treatment. Not for low back pain. Can you guess for which complaint he came back? He came for the treatment of the cervical spondylosis. He told me, Dr. Saab, I am absolutely black, don't have any pain. I am traveling, I am doing all my agriculture and everything, but I am having severe pain, neck pain. MRI shows severe cervical disc degenerative changes. That time, we give switch over to Prasaranyadi Kashayam, Kshirabala, Kaishora Gulgul, Praval Bhasma, and Intukantagradam at bedtime. And we did Shirobasti in that case also. Not Shirodhara, Shirobasti. So this is one case I want to tell. Whatever the doubts you are having, kindly ask in the end. And the second case was a female case, aged 35 years old. She was suffering from chronic rhinorrhea. I think most of you are not, if you are not aware of rhinorrhea, kindly Google it. It is a constant flow of thin, colorless fluid from the nose. That is different from sinusitis and postnasal dripping. It's a continuous flow of the thin fluid. Sometimes it is purported in the text medical books that cerebrospinal fluid also mix it with it. Continuous flow, secretions from the nasal area. Severe, continuous, thin, watery oozing from both nostrils. She had to use 10 to 15 handkerchiefs every day, oozing even during the night, and it used to wet her pillow also. So in front of me also, she used to carry the kerchief and put it like this and talk. You can see that from the pipe, as if from the pipe, the flow is there. But there was no resistance, no sneezing. Occasional severe headache was reported. But there was Agni Mandya. She was not having proper taste, not eating properly, and eating all the fast food and everything. All the Vama conditions were reported. Little bit obese, but her no history of diabetes or hypertension or cardiovascular diseases. Her menstrual cycle was normal. So in this case, it is the state of kapha, shiras, but the complaint is vatadhika because of the excessive flow, the adhisrava from the nose. We don't know the condition. In this case, we did a few days ampajana and mild videjana in the beginning with avipatti churna. We switched over to patyaksha dhatriyadi kashayam with jagari. I think most of you may be knowing patyaksha dhatriyadi kashaya. It is one of the best kashaya kada recommended by the acharya for the most of the ENT diseases, especially shirashula, netra roga, karna roga, throat, gala roga. Even in the thyroid complaints also you can get. But it is very famous in Kerala practice. The same formula is available in the name of Migracot tablet in Kottakkal Ayurveda. The taste of this kada is very, very bitter. And if you take kada alone, you may get gastric irritation. That is why Acharya has recommended you have to add little bit of jaggery in that one, to be taken morning 6 o'clock and 7 o'clock. Those who are having high gastric irritation and high acidity, by taking in the empty stomach, take it during in the morning 10 a.m. after taking some breakfast. So it will not create gastric irritation. So these are all practical points I am telling. And the Murdavega Arishta 25 milli twice after food. If you see the Murdavega Arishta Bhalastudi, that is the only Arishta recommended for all the ENT conditions. All ENT conditions. And Intukanta Gridam, 2 teaspoons, heated, melted, to be taken at bedtime. Vadamaya Kshaya Mahodara Gutma Shula Nimnonada Joraharam Balavaratharamcha. So it is very good for the ENT diseases also. So in this case, we started with the Abhyanga and Nasya. Valasugandhadi Taila for the Abhyanga, and we used Ksherabala 101 for the Nasya. I diagnosed in the beginning as a chronic sinusitis, penasa, dushta penasa. So because of the Atisrava, I thought it is better to start with the, instead of Anutaila or Shadbindu Taila, Ksherabala 101. Patient could not tolerate this nasyam. Patient could not tolerate the nasyam. If you pour 4 to 5 drops of this, the patient used to get irritated and nauseating feel, and headache also increased. After 2 days of rest, we switched over to the Shirobasti treatment. Shirobasti, in the Shiro Taila application, Pichu, Sheka, Shirobasti, and Abhyanga. Abhyanga, Pichavo, Taila, Shirobasti, Chedi. 4 procedures are there for application of the head oil. Abhyanga, everybody we used to do in the everyday morning before bath or after bath, or during the massage also we do the Shiro Abhyanga. Is the oil is taken in a small cloth or cotton and vertex, and either this thing is Shiro Dhara, Taila Dhara, that is in the lying position we used to do. And the Shirovasti is the one of the best procedure for most of the ENT diseases and neurological diseases also. Even for the Paksha Khada, Parkinson's disease, dementia, Shirovasti is very, very, very effective. So I consider this chronic rhinorrhea as a Vatadhika state of sinusitis. Acharya says If it is a Vatathika, we do go for the Vatavyati Chikitsa. So for Shirogata Vata, Dhanvantara yoga is very, very effective. In Kerala, we use for the Shiropichu, Shirodhara, Tailadhara, and Shirobasti also. Shirobasti, the patient has to sit in the chair and we put a cap over the head and fill that head with a particular oil, in this case, Shirobasti. After 15 minutes, we have to change the oil. We have to pour that with a new oil. Lukewarm, just warm. It should not be too hot. So the procedure here in our Kerala lasts for 1 hour. Every 15 minutes we change. And if possible, during that procedure, another person can do a body abhyanga with the same oil or different oil. This is the procedure of the Shirobasti, 1 hour. So we did the treatment in this case also using the internal medicine also. Patients start getting slight improvement after 15 days of Shirobasti, not immediately. This is a very important thing that people expect immediate result after the hospitalized Panchakarma. We cannot show immediate result just like modern medicine after hospitalization. So we have to counsel the patient in the beginning, sir. Don't expect any miracle immediately after the discharge. You will get the slow, gradual improvement after the discharge, following the diet pathya and following the follow-up medication also. So in this case, patient reported some improvement after 15 days. After 8 months, she came for the second treatment and reported that she got 60 to 70% of improvement after the first treatment. And a third time, she came after 1 year and she reported that absolutely no symptoms. That is the second treatment itself, the oozing has completely stopped. So third time we did as a precautionary measure, same procedure, same medicine. That patient is still with me after 4 to 5 years of treatment. Still she used to come for the some other complaint, not for the rhinorrhea. And I told her, you use only Dhanvantara Thailam for head application lifelong. No other oil to be changed. She is following that pattern and no symptoms at all. Friends, see the wonderful results of Shirobasti. Sushruta Acharya says, Shirobasti in the Vatavya Chikitsa, Pakshadhada Ardhida in context. He understood some connection with the brain and Ardhida and all these things. So if it is a Vatavya, Shirobasti is very effective. This will not create any side effect, complications, nothing. You people can do it. Please do it. So next case is a very, very complicated case. He was from Tamil Nadu, male patient, 45 years old, very obese, 95 kilos, and he was already suffering from type 2 diabetes, 15 years, hypertension, 13 years, and see the last point, schizophrenia. He was on modern medication for schizophrenia, hypertension. He was having very bad lifestyle, irregular lifestyle, and chronic alcoholic and smoker also, because he was into a business of fish market. He used to purchase fish from the Tamil Nadu and Kerala and export it to other European countries. So he used to travel extensively to all these states. So all these bad habits related to the business and everything. And already mild left ventricular hypertrophy was reported. So his HbA1c was 10 and reported fatty liver changes also. So he came for the hospitalized treatment. He told me in the beginning, sir, I want to undergo all the Panchakarma procedures, whatever possible, including Kalpa Rasayana. That is the Rasayana treatment. So we were very happy to take that case. I explained to him all these things. Mahendra Gagre, please mute. You please. Please mute Dr. Arjun.
സാറേ ഇനി ഒന്ന് അൺമ്യൂട്ട് ചെയ്യൂ സാർ. ഞാൻ എല്ലാവരും മ്യൂട്ട് ചെയ്തിട്ടുണ്ട് സാർ. അവിടെ നിന്ന് അൺമ്യൂട്ട് ചെയ്യും. കേൾക്കാണ്ട് പറഞ്ഞോളൂ.
Okay, so he came to us saying that he is having sufficient money and sufficient time. He is not in hurry. I'm ready to stay even 2 months also. So we happily took the case and we started the treatment. And in the beginning, some mild Panchakola, Churna and Virechana, everything was given. And we started with the Sneha Pana treatment. Sneha Pana treatment with the Mahapanchagavya Gradam. Mahapanchagavya Gradam is very good for the all the Apasmara and Unmada Rogas also. And it contains the Panchagavyas. It is very good in the diabetes also. We didn't consider his hypertension as a major issue. And we started with the 50 ml, 50, 100, 150 like that. 7th day he could take 200 ml of the Sneha Mahapanchagavya. And during the Sneha Pana days, we gave him just a simple oil application, that is Abhyanga in the evening with the Dhanvantara Taila. After 7 days of Sneha Pana, we did Svedana Karma for 3 days, Abhyanga and Svedana Karma. Always Svedana Karma should have a prefix of Abhyanga. So 3 days of Abhyanga and Svedana Karma. Then 2 days continuous Virechana. Virechana Karma was did with a Trivurt Churna 20 gram. We thought a 10 gram and all not going to work. So 20 gram 2 days continuously. He used to go to the toilet 5 to 10 times every day. During that time, Payadi Karma, Pathya Karma, everything was followed. And after this Snehapana, Svedana and Virechana, we started the medications listed in the slide. That is Kathaghadharadi Kashayam in Nidujyadi morning, Varavishaladi Kashayam and Manasamitra Vadagam in the evening. Kathaghadharadi Kashayam is a famous yoga, Sahasra Yoga, what Ayurveda is preparing. And Nirujyadi Guliga is a very good anti-diabetic tablet. That is with Kotakara Ayurveda only. And that is in the morning. Varavishaladi Kashayam is another name is the Kalyanagan Kashayam. That is the Kashaya Kata Yoga of the Kalyanaga. Please remember Kalyanaka Grida. And along with that, Manasamitra Vadaga in the evening. And Mahapanchagavya Gradam 15 ml every day at bedtime. Kaya Seka and Takradhara for 14 days. Kaya Seka and Takradhara for continuously 14 days. After 14 days of the Kaya Seka and the Takradhara, we switched over to the Churna Pinda Sweda and Shirolo. Lepa with the Amliki. During the treatment only we apply. Each treatment lasts for 1 hour. The spiritual Kaya Seka 1 hour, another 1 hour Takradhara. 2 sessions we give. And Churna Pinda Sweda and Shirolopa Lepa for 1 hour. During this Churna Pinda Sweda and Shirolepa, we gave him 15 days of Kalbasti Bista Rachayapana Yoga. Rachayapana Basti Yoga. 15 days. Okay. So this Rachayapana Basti Yoga kindly refer the Ashtanga Hridaya Kalpasthana or Charaka Kalpasthana Basti Yoga. All these things. all the major type of Vata Vyadhis, Rajyapana Basti is very good, very effective, and it is a Brahmana Basti also. Why slide is Arjun slide is not moving?
Sir, slide മാറ്റുന്നുണ്ടോ sir?
Try not slide is not moving.
ആണോ? നെറ്റ് ഡൗൺ ആണോ sir അവിടെ? നെറ്റ് ഡൗൺ ആയാൽ സംഭവിക്കാം. സാർ ഒന്ന് റിഫ്രഷ് അടിച്ച് നോക്കൂ. സാറിന്റെ കഴ്സർ മൂവിങ് ആണല്ലോ. മൂവി ഉണ്ടല്ലോ.
Sir, complain of second case. I need complaint.
Okay, so Rajyapana Basti 14 days continue, and after 1 or 2 days of rest, we switched over to Vardhaman Pipali yoga. During the Vardhaman Pipali, morning Vardhaman Pipali we used to give, and evening one Abhyanga we used to give. Abhyanga.
Hello sir. സാർ അൺമ്യൂട്ട് ചെയ്യണം സർ. സാറ് ഇപ്പോഴും മ്യൂട്ടിലാണ്. എന്ത് പറ്റി സർ? ഹലോ, please stay on 9. There is some technical difficulty there. Yes.
Okay, now okay.
പറഞ്ഞോളൂ.
So sorry for the inconvenience. So every day we used to increase 5 gram, 5 gram, 5 gram like that. But in my practice, it is found that so all people cannot tolerate more than 30 to 35 grams of pipali. 30 to 35 grams. I calculated that an average tipali, dry tipali weighs about 1 gram. So 5 like that. Acharya thought 3 also, but my standard is 5 gram. So 30-35 gram only maximum one person can consume at the maximum. So in that level, kindly continue that way. Then the 11th day onwards, kindly reduce slowly. This is my pattern. Your pattern may be a little bit different. So in this case, I started 5 gram and up to 50 gram, though it is told, but this fellow could tolerate only up to 40 grams. Please hear me. Up to 40 grams only he could tolerate. I did not compel him to take more. because if you compare the nausea, vomiting, and all these things, why I selected Pipali in this case of so all these things, diabetes, pramehahara, and medhya. Pipali is having a medhya according to the Bhava Prakashara. It's very good medhya. So that is the two reason I selected Pipali in this case. And during the Rasayana Chikitsa, we used to give him only Kshira, Anna, Shastika Anna. And if he demands boiled vegetables only and drinking milk only, the entire 19 days he tolerated the procedure and he was very well responding to the treatment. And let us see the result. And after this, during the discharge, he was given a very few medicine, Katagadaradi, Katagadaradi, Varavishaladi, and Panchakabyagada as a continuous follow-up medication only. You won't believe, without my knowledge, he stopped all the modern medicine for diabetes, hypertension, and schizophrenia after 1 month. I was not aware of all this. He stopped himself. After 2 years, he came back with the same report. That time only I was informed that during the entire 2 years, he was not having any problem with the diabetes, hypertension, or schizophrenia. This is the result, the impact of the Panchakarma and that procedures we have done. And I should say the Rasayana procedure also. For 2 years, he could avoid the 3 modern medicines. And why it restarted all this problem? Since he was in the beginning business, he slowly started with the smoking. Then alcohol. All these together, his schizophrenia also slowly started. Then if you very lower dose of hypertension, schizophrenia, and BP medicine, he started, diabetes medicine also, he started. That stage he came, but that time he was not having sufficient time, only 14 days. I couldn't do the Rasayana, but we did the Snehana, Svedana, Takradhara, and Basti also, Rajayapana Basti. After that, he didn't report. But during the first time treatment with the Rasayana, excellent result. So these are the 3 cases I would like to present in front of you. Now you can ask me questions regarding this. Thank you very much for patient hearing. And if there is any mistake, kindly.
Sir, ഒരു ക്വസ്റ്റ്യൻ ഇവിടെ ഫസ്റ്റ് പേഷ്യന്റ് ട്രീറ്റ്മെന്റ് ഒന്നും കൂടെ സ്ലൈഡ് കാണിക്കാവോ എന്ന് ചോദിച്ചിട്ടുണ്ട് ഒരാൾ ഇവിടെ മെസ്സേജ് അയച്ച് ചോദിച്ചിട്ടുണ്ട്. മുകളിലേക്ക് കൊണ്ടുവരാൻ പറ്റുമോ സർ?
കൊണ്ടുവരാം. Treatment. First treatment is the oral medication. This is the oral medication, and the Panchakarma. This is the Panchakarma given. Which okay.
Sir, good evening, sir.
Good evening. Please ask question.
Sir, regarding Marma Golika or Karutha Golika. Sir, actually, I am not able to, use those Golikas because they are very, very hard. So
Yes.
How do you generally do that, sir?
Yeah. What you have to do, you take the tablet and put it in a little bit of hot water in the morning. By evening, it will get softened. थोड़ा पतला हो जाएगा. फिर क्रश करके पेस्ट बनाओ, फिर लगाओ. ठीक है.
सर, गर्म पानी में तो डाला था, बट कितना टाइम डालने का ये मालूम नहीं था.
सुबह डालो, शाम को पतला हो जाएगा. सुबह डालना, शाम को पतला हो जाएगा.
Thank you.
Hello, sir. Can I ask you a question?
Ask, please ask.
Okay. So, when we post a patient for Vaman, for example, and when Snehapan is going on for the 7 days, that time, is it advisable to do Snehan and Swedan along with Snehapan?
If the Snehapana is a Pakka Snehapana, increasing every day and 7 days course, evening you can do just Sneha Abhyanga only, not Svedana. If the Snehapana is a very small dose, 15 to 20 ml, and that time you can do the Snehana and Svedana in the evening. 7 days Snehapana course. Please don't do the Svedana in that time.
Okay, so when the dose is like 30 ml, 60 ml, 90 ml, we are not supposed to do Svedana.
Svedana, only Abhyanga.
But if we do Abhyanga, how will we differentiate the skin, Mardhav, etc.?
There will be a little bit problem, but the experienced doctor can easily understand all these things.
But it is better if we do Snehana during Snehapan.
Yeah.
Okay, and the
Andarika Snehana and Bahya Snehana, both together.
Okay, and the Swedan has to be done, Snehan Swedan, on the rest day.
After 7 days, 8th day, 9th day, and 3rd day.
Okay, and a 7-day evening means after finishing the Snehapan, can it be advised?
Yeah, 7 day after, immediately after that, Svedana is advisable.
Okay, okay. Okay, sir, thank you. And sir, Vardhaman Pippali Rasayan, what is the Anupan?
Kshira. Kshira is the Anupan.
Okay, can we give it as Kshirapak, sir?
Kshirapaga also you can give, Acharya says, Churna with Kshira, Kshirapaga, Pippali Kashaya, according to the digestive status you can, but everybody digests easily Kshira, Pippali Churna with the Kshira. That is my experience.
Okay. Okay, sir. Thank you, sir.
Okay.
Sir, as you said, we can do Abhyanga with Snehapana. Can we do Nasya also with Snehapana then?
No.
Okay,
if it is a Pakka
Abhyanga.
Snehapana, 7 days don't do Nasya along with that one.
Only Abhyanga is allowed, that too in the evening, right?
That too in the evening.
Okay, thank you.
Can we give Marmagulika internally? No, Marmagulika internally is not recommended. But Valiya Marmagulika internally is recommended. That is very effective in various urinary tract diseases, kidney diseases, kidney failure, high urea, creatinine, and uterine diseases, uterine inflammatory diseases, and Vata Vyadhi also.
Sir, vitamin D tablets ne pagaram nammal adinathu endu medicine a sir kodukkan pattunne? Vitamin D
Nowadays we are giving deficiency, we are giving C Health 40. Nowadays we are giving C Health 40.
Gandhadailam kodukava sir?
Gandhadailam also good.
Yes.
Hello, sir.
Yes.
Sir, this vitamin D deficiency, sir, how long we should give this all Gandhatela or Ksheerabala?
Gandhatela, according to the severity of the condition, 1 month, 2 months, 3 months, you can give. There is no harm.
Okay, sir. And sir, first case was degenerative changes, and again we have, sir, it's Amavastha you have considered. So you have given Rasnadi Gruta and Ashtavarga is also Ushna. So what you had think, sir, about that case? Because I am confused. It is degenerative changes also, and you this Ashtavargam is Ushna Kashaya and Rasnadi.
Yeah, though there is degenerative changes, Ashtavarga is best anti-inflammatory. It improves the rakta, the quality of the asti dhatu, mamsa dhatu. It reduces the inflammation, and the Grida is Rasnadi and Gopalatiktaga is Brahmana also. So both together we can give. There is no harm in that one. Very good result also.
So if it is Rasnadi Ghruta also, it means
Rasnadi Ghruta also.
yes, if it is we give plain Rasna Kasha, it will be harmful. But if we give Ghruta, it will not cause the Pitta Vardhana like that.
No, no, it will not cause Pitta Vardhana or anything.
Oh, okay, sir. Thank you, sir.
Sir, for Shiro Basti, how much quantity of oil we used, Dhanvantar?
At a time, according to the size of the head, you require 200 ml to 300 ml of oil at a time. So we used to take 300 to 600 ml of oil, keep ready, and we change it every 15 minutes, 200 ml, 200 ml like that.
After that, head wash is advisable or not, sir?
Which one? Head wash. Abhyanga and this thing, Abhyanga is Shirobada, Snana is recommended, but according to my practice, that is not advisable because the patient easily catch cold and cough. So the procedure will be interrupted. So I used to tell the patient, don't take head bath for 7 days.
Excuse me, sir. Good evening, sir. Sir, I have a question.
Yeah, tell me. Ask me.
Sir, actually, I have been given a patient, उनको hyperthyroidism है. So I've been giving her Panchakit Grit Gugulu, Arogya Vardhani Vati, and Gandik Mala Kandan Ras with Shatavari capsules. So she has been responding well. But now she has been complaining of increased itching again. Like itchiness was her first complaint. So what should I alter in the treatment? Like
I think some problem with the medicine. Some problem is creating. So switch over to the Mahatiktaga and Kanchanar Gugulu. Like that you can switch over. In the thyroid medicine, we don't give so many medicines. Very minimum medicine.
Raji, Raji.
Thank you, sir.
Hello, sir. I want to ask one question. In Shiro Basti, can we repeat this oil? How many times we can use this oil?
Please ask me once again. I am not able to hear.
Hello, sir. For Shiro Basti and Shiro Dhara, we use the oil. Can we repeat this oil for next?
So
how many times?
We used to take it for 2 days continuously. Every 2 days we used to use this.
Okay. Thank you, sir.
Excuse me, sir. Can I ask a question? Sir, what would be the best timing to give Snehapan for a patient whom we are preparing for Vaman?
Any Snehapana 7 days course, morning 6:30 to 7 o'clock, fresh empty stomach, we have to give the Sneha or Grida. And once the digestion, when ghee digestion is completed, giving Pathya Bhojan.
Okay, sir. Should we give some warm water along with the Sneha? Or
definitely. Acharya says Shundhi Ushnodaga. Shundhi Ushnodaga should be given along with the Grida. Afterwards also, if he is feeling thirsty, you have to give Shundhi Ushnodaga.
Thank you so much, sir.
And so what is the reason that we don't do Snehan Swedan along with Snehapan?
See, we are mainly concentrating upon the Ulklesha of the dosha. What is the purpose of Svedana? Whatever the Ulklishta doshas are there in the doshas are in the Srotas, is all being slowly dragged towards the Koshta. That is the purpose of the Svedana. So both together in a Pakka Snehavana will not be giving proper result. So first you do the Snehavana, then go switch over to the Svedana. All these mild Snehavana and Svedana I am not talking. Pakka 7 days procedure. So both Ulkleshana and Sweda, this thing should not be that. you will not get the result.
Okay, sir. Thank you.
Hello, sir.
Sir,
I want to ask you one question. For diabetes, you mentioned Kataka
Kadiradi Kashaya.
So can we directly use for diabetic patients? How?
Yeah, definitely. That is a very common practice in Kerala to start with the Kadiradi Kashaya, Shilajit Basma, Yashadha Basma, Nirurya tablet. Or if it is second stage, we used to start with the Nisha Katakadi Kashaya, Kada. All are available with the Kotakalari Odishara.
Yes, sir. Yes. Thank you, sir.
Sir, what about juvenile diabetes?
What about?
Juvenile diabetes, type 1 DM.
Yeah, juvenile diabetes, sir. Frankly speaking, it is very difficult case. We cannot treat. They have to switch over to the insulin. I tried in so many cases and now I stopped taking such cases. You will not get any result. If the patient is at aged 15 to 20 and if he's very cooperative, then only the children used to follow the diet pattern. No children will do the exercise, yoga and all these things. So according to my practice, my opinion, juvenile case, we cannot treat.
Thank you, sir.
Maybe your experience may be different. I don't.
Excuse me, sir. Hello.
Yes.
Sir, can we give internal medicine during the treatment of Basti?
During the?
Basti treatment, sir.
During the Basti treatment, internal treatment. Our practice that morning we used to give Basti, evening we used to give some Samana Aushata. Not in the morning session. Kashaya Basti and all these things, morning session we don't give any medicine. Evening session we used to give mild Shamana Aushatas. That is a very nice question. I appreciate it.
Thank you, sir.
Sir, in dyslipidemia, like high cholesterol, Panchkarma is advised. Then which procedures we should do? Like Snehapan we can do or we can't?
Definitely Snehapana you can do. I have not seen a cases which increases the Snehapana. So many researches has been done in various postgraduate center with this Snehapana and cholesterol. I told you, no, immediately after the Snehapana and all, we cannot see any improvement. And if you do the Snehapana and Virechana, definitely the cholesterol and the dyslipidemia decreases. And moreover, the doctors nowadays says that there is no connection with the grida and the coconut oil use and grida use with the cholesterol. It's all related to the metabolism. Even the cardiologists, recently we had a conference in Kerala, Modern Doctors Cardiologist Conference. UK newspaper reported that cardiologists are openly telling in the podium, you can use the coconut oil and grida as much you want. There's nothing to do with the cholesterol or cardiac disease. So modern medicine has changed that view.
Which group cancer or any according to body?
Because Indukanda, Bukulutiktaga and all these things are very effective.
Hello, sir. Thank you for the informative lecture. I just want to ask one question about the differentiation in Shirobasti and Shirodhara. Means where specifically we can use that Shirobasti instead of Shirodhara. Like in Rhinorrhea patient that you described, we understood that the secretions were there, and so position according to the patient's position, Shirobasti is more suitable. But still, is there any specification that only Shirobasti can be done and Shirodhara is not indicated like that, or both go similar?
Actually, there is no specific demarcation for this Shirobasti and Shirodhara. It all depends upon the physician's decision. In my experience, this Ardhita, trigeminal neuralgia, and all this ENT dementia and Kampavata, Shirobasti is more effective and Rhinorrhea type of case. If the patient is unable to sit with the Pakshaghata and all other complaints, and the head used to move badly with the Kampavata, Shirodhara can be done. So that depends upon the physician's decision. Shirodhara in the lying position, otherwise patient has to sit 1 hour. There are patients you cannot sit 1 hour because of the so many reasons.
Depends on the sitting position, if comfortable or not.
Which one?
Mainly. Otherwise, only because of the sitting positions or the conditions of the disease, which will they
We
carry
can decide.
it or not?
We can decide.
Okay.
We can decide.
Otherwise, it's not remarkable. This is
There
not
is not much differentiation we are saying practically. Practically, I don't see any change.
Just the mode of procedure. That's
Yeah,
important. Okay. Thank you, sir.
Namaste, sir.
Namaste.
It was a wonderful session, sir. Really, we are blessed to hear to it. Sir, one of the patient, just post angiography patient, the creatinine level is 1.9. It is not responding to allopathic medication. How we can help them to, control the creatinine level, sir?
See, creatinine level, to reduce the creatinine level, I used to give this Shilajit and Malia Marma Guliga twice daily before food.
Okay.
I found it quite effective. If you want, you can try that also.
So can we try along
and
with
Gudichadi Kada or Kashaya tablet also very effective. Kumaram Yogam is also very effective in creatinine and urea. Okay.
Okay. Sir, along with allopathy medication, can we continue those medications?
Yeah, you can try.
Sir, I one more doubt, sir. Can we advise classical Virechana for such patients, sir?
Urdu Virechana is good.
Urdu Virechana is good. Okay.
Yeah.
Okay. Thank you so much, sir.
Namaste, sir.
Namaste.
Sir, one doubt is there, sir. Actually, for Manasika Vigara, we shall we, is there any relevance to practice Takradara before Snehapana, sir? For Rukshana purpose?
Actually, if you ask me that, you can, that is right. But it is better to start with the Snehapana, Vaman, Virechana, then switch over to the Takradhara. Takradhara is not only Rukshana, it is Shamana also, Prasadana and Shamana also. So it is better first you do the Sota Shuddhi, Koshta Shuddhi with Vamana and Virechana, Snehapana, Vamana and Virechana. Then if you do the Takradhara, better result.
Yes. Thank you, sir.
Okay.
Good evening, sir.
Yeah,
so
ask
I
me.
have a question. Sir, actually, it's about my mother is having hyperthyroidism, and her main complaints are like sunkenized, that is exophthalmos, and itchy skin, and she has lost quite a lot of weight. So I would like to know that can I start Snepan and Sweden at home itself, and what external medicines should I give her?
Snehapana, you can start with Indukanta Grada, Abhyanga with Dhanvandara, Yamaka Sneha, and if possible, Shiro Piju can be done with the Dhanvandara Yoga. Okay.
Hello.
Okay.
And for medicine?
Medicines, you can start with Gurchyadi or Mahatiktaga, or as I told you, Pratyaksha Datriyadi Yoga, morning and evening. And Kanchanar Gugulu twice after food. And Kotakalar Vaidishala is having a Swayam Agni Sindhura capsule. Swayam Agni Sindhura capsule. That is very effective in hypothyroidism. Hypothyroidism is very effective. Swayam Agni Sindhura.
Sir, can you please unmute yourself? I just muted everybody because there was that much disturbance.
Yeah. So,
Okay.
sir, she has hyperthyroidism actually.
Oh, no, not hypo. Sorry. I misunderstood as hypo. So, if it is hyper,
Yes,
what we
sir.
have to think about our according to me, that is a Brahmana Chikitsa. Then you can think about Bidaryadi Gana, Bidaryadi Kada, Bidaryadi Kwatha, and Bidaryadi Grida you can.
Ji, sir.
Okay, and in that case, Takradhara, Kshiradhara may be effective. Second, the Kshiradhara may be effective.
And for medicine, same.
Medicine, I told you, no? Vidaryadi Kashaya, Vidaryadi Kwada.
Yes, sir. Yes, sir.
Okay. This thing. Don't give Kanchanar Gulgulu or this thing. Swayam Agni Sindhura. Gudchadi you can give. Okay.
Okay,
Namaste,
sir.
Good evening, sir.
Good evening.
Sir, I am suffering from multiple sclerosis. I want to know its treatment.
Actually, madam, for multiple sclerosis and all, we have to see the medical reports first and assess your dosha prakriti, dhatu, sharira prakriti, and you have to undergo a hospitalized panchakarma treatment.
Yes, sir.
So you have to come to
Actually,
Kottakkal.
my left leg is weak, mostly weak. I am not walking properly, and my vision also damaged. That's why.
So we used to start with the Kalyanaga Gradam Snehapanam and
Okay,
Shirobasti we used to give. And a very important thing, doctors, you have to see that there are two types of neurological disease. One is degenerative neurological disease and inflammatory neurological disease. Multiple sclerosis comes under inflammatory neurological disease. So in the case of the inflammatory neurological disease, do not give Ushna Prayoga too much.
Okay, sir.
Though Vata responds easily to Ushna, the Ushna Prayoga is, in this case of multiple sclerosis, is not advisable.
Okay.
So, Mrudu, Madhya Ushna, Snehapana, Abhyanga, and Shirodhara, all these things are very good. And Basti is very effective. Shashtikanna Binda Sweda is very effective.
Okay, sir. Thank you. Thank you, sir.
Namaste, sir.
Is there any treatment for
treatment for
lipoprotein?
Which one?
Increased lipoprotein.
Microprotein.
Lipoprotein.
Lipoprotein.
Yes.
That we Indukantaka yoga is very effective. Indukantaka Shaya and all these things are very effective.
Thank you, sir. Thank you.
Metabolism, correct them your metabolism. So,
Namaste, sir. Sir, how do we understand the concept of low BP in terms of Ayurveda and how do we manage it? The ECG shows normal and the hemoglobin levels are also in the optimal level. Thyroid profile is also fine. So,
if the patient is suffering from low BP, just in the 1 or 2 sitting itself, you cannot diagnose is at normal, no low BP, number one. And if at all you consider this is a normal, low BP, so many people are having low BP as a normal BP.
But there is giddiness associated.
With that itself, they are able to carry out all these normal, their work and everything, brain function, everything is normal. They ignore it. Still, if that condition is creating a lot of problems, think about Pitta Prasadana and Vada Bruddhikara. What is the best? Drakshadi yoga is one yoga, Pitta Prasadana, Indukanta. I used to give Drakshadi and Indukanta mixed together, Kada, morning and evening, and Ashwagandha Arishta with the Suvarna Muktadi Gudiga. That is the best combination. Very effective. Slight improvement in the blood pressure. You cannot expect miracle, slow improvement only.
Okay, sir. Thank you.
Namaste,
Good evening,
sir.
Good evening, sir.
Good evening.
Sir, my brother is suffering from leukoderma since 1 year and it is increasing day by day. Then what should I suggest?
See, with the proper virejana, kushta adhyaya recommended proper virejana and everything, you can start with the Chitrakasava. Very effective. Our Kottakkal Chitrakasava is wonderful result. Very good result. Please see the Chitrakasava. Chitrakasava is very effective.
Good evening, sir.
Good evening.
स्थिराणी ये पसरणार यानी स्प्रेडिंग एंड नॉन स्प्रेडिंग ऐसा कोई डिफरेंस रहता है सर उसमें?
क्या बात समझा नहीं प्लीज आस्क मी
सर उसके 2 प्रकार रहते हैं ना, एक स्थिराणी एक पसरणार यानी स्टेबल एंड अनस्टेबल. देन चित्रकासव should be used or not in leukoderma?
Leukoderma Chitrakasava, it is effective in the Shobha also. Which condition you highlighted? I didn't hear you properly.
Sir, it is spreading. I am not stable. It is spreading.
Yeah, you can, yes. Vajraka Kashaya is very effective. Vajrakam Kashaya. Manjishtadi Kashaya you can try. Chitrakasava with the Khadirajishta you can try. Okay.
Namaste, sir.
Namaste.
Sir, how should we manage patient having atherosclerosis with diabetes and hypertension?
Which one? Which one?
Atherosclerosis with diabetes.
Across?
Atherosclerosis.
Avascular necrosis.
Atherosclerosis.
Atherosclerosis.
With diabetes and hypertension.
Yes, they're very complicated condition. And advanced diabetes and atherosclerotic changes are very complicated. Very lot of cases I see. It is very difficult to treat. You cannot do even an abhyanga in that case. So usually my prescription contains Manjishtadi Yoga, Purnavadi Yoga, Purnavadi Mandura and Kaishora Gulgul or Gugul Panchabal internally. And Manjishtadi Thaila for external mild application, no abhyanga. Because if you do the abhyanga in such conditions, internal damage of the vessels happens. That further aggravates. Though in the Shastra, the diabetes management Udvartana has been recommended. All of the cases you cannot do the Udvartana. If the atherosclerotic changes are there, Udvartana will aggravate it. So be very careful about the Udvartana and atherosclerotic changes. So I'm telling it from my practical experience. So Manjishtadi, Kaishor, Purnavadi, Mandura, and Google Panchabala, all these things are very effective.
Hello,
Good evening,
sir.
sir.
Good evening, sir.
Good evening.
Sir, how can we treat multiple lipomas, sir?
Multiple?
Lipoma.
It is an asadhya case, madam. We cannot give any result. I used to say in advance itself, we cannot expect any results. Now I remember our late managing trustee, Dr. Padmabhushan, Dr. P.K. Warrior, sir. One multiple lipoma case and another case of neurofibroma reported to him, came to him. What he recommended, he told the patient to take 50 ml of Gomutra every day. Every day, morning and evening, Gomutra with some diet pathya and no other medicine. You won't believe that both lipoma case and this neurofibroma case started showing positive changes after 6 months. So the patient continued for 2 years and 50 to 60% improvement in the case. And in my experience, I used to give Khadrarishta Chatragasava plus Kaishor Gulgu twice after, and ask the patient to do that every day, yogasana or some other exercise.
Okay, sir. Thank you, sir.
Hello.
Good evening, sir.
Please ask.
Good evening, sir.
Good evening.
Sir, my mother is suffering from hypothyroidism and hyperacidity, sir. And 15 years back, she has been fall down very badly and her waist has been swollen and very painful, sir. So what would be the treatment for all the three, sir? Hypothyroidism, hyperacidity and...
We have to see the patient and we have to see all the medical report, X-ray report, everything. Otherwise, we cannot treat. Kindly contact our branch, Dr. Anand Warrior, Bombay branch, Matuga.
Hello.
Hello, please.
Hello, sir. Sir, how can we increase ovum size and for ovulation?
That is a very good question, though it is not related to this thing. Our concept is to give the Grida Sneha Pana. Phalasarpis is one of the best medicine for such cases. We cannot assure that ovum size and everything, but we have seen cases the fertility condition has improved. That is where they have become conceived. Phalasarpis, very good medicine. Both male and female. Kindly see the Ashtanga Hridaya Yoni Vyabal Chikitsa. Phalasarpis is recommended in the both Purusha Vandhyada and Stri Vandhyada. And we have seen cases, we have treated cases, very good result.
Sir,
And
how much will be the dose?
Dose every day 50 ml morning empty stomach.
Sir, is it recommended on any phase, menstrual cycle phase?
During the menstrual cycle, avoid the Girdapana. If there is no menstruous, take every day morning.
Hello.
Okay, sir.
Good evening, sir.
Good evening.
Sir, can we use phalasarpy in pregnancy?
Pregnancy, it is not the Phalasarpy, it is the Kalyanaka Grida first 4-5 months. Kalyanaka Grida is recommended because that affects the brain function, brain development of the child. After 6 months, Sukha Prasavada Grida is recommended.
Okay, thank you, sir.
Okay. Okay.
Hello, sir. I want to ask after 6 months, and what is
after
the
6
dosage?
months, Sukha Prasavada Grida. 2 to 3 teaspoons before lunch or before breakfast with warm water.
And the Kalyanaka Grita dose?
Same dose, morning or before morning.
Only
Hello,
once.
sir. Only once.
Okay, sir. Thank you.
Hello, sir.
Hello, sir.
Hello.
I want to ask sir about Rukshana Chikitsa. Like in many patients who are willing for Panchakarma only, Samyata is found, Samata is there. So before starting Sneha Karma, Rukshana is also advised. But there is no specific mentioning about the duration of the Rukshana Chikitsa. So can you please guide, sir?
That and all depend upon the Deha Sthiti, Roga Bala, Rogi Bala, Prakriti, and patient's willingness to undergo the Rukshana 7 days. See, nowadays the people are not ready for following.
Yes.
Good evening, sir.
Good evening, sir. Good evening, sir. Sir,
Sir,
please
can I
guide
ask?
for the cervical spondylosis with radiculopathy, sir. Hello.
Hello.
Excuse me, sir.
Hello.
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 Wrong number.
Hello.
There is some technical difficulty. I am calling him. He will come back soon. Don't worry. He will log in shortly. In his space, there is a network is very bad. That's why. He will log in shortly.
Hello.
Sir, കേക്കാം. പറഞ്ഞോളൂ sir.
Yeah, please. Any other questions? Please ask.
Sir,
Plantar fasciitis, sir.
What?
Plantar fasciitis. Sole pain in
Plantar
sole.
fasciitis. So many treatments are there, sir. Potli, Pinda, Sweda, and this Sarshapadi, Leba. All these things are very effective. Plantar fasciitis, so many treatments are there. Allergy.
Side for the cervical spondylosis with radiculopathy, sir.
Cervical spondylosis with
radiculopathy, sir.
Retinopathy.
Radiculopathy, sir.
Radiculopathy, Shirobasti, best treatment.
Sir, allergic rhinitis with very common old cold.
Sir, Shirobasti and sir, tablets are ready.
Yeah, Saranyadi Kwada Kshirabala.
Vascular necrosis and connective tissue disorder.
Vascular necrosis cases very difficult to treat. That requires hospitalization. So, in my experience, we can reduce the swelling, inflammation, and slight disability in the walking and all. A complete cure is impossible. In that case, we start with the Dhanyamla Sneha, Dhanyamla Dhara, then Potli Sweda, then our Shaktikarna Pinda Sweda and Basti. That gives some relief, but impossible to give a complete cure.
And if it is post-COVID, then?
Post-COVID?
AVN, avascular necrosis.
If it is post-COVID, sure means they can do all these. Dhanyamla Dhara, Taila Dhara, Lepana, and Shashtikarna Sweda.
Okay. Thank you,
sir. Sir, allergic rhinitis treatment, sir.
The allergy, Bombay and all this area, allergy due to the high pollution rate and all. The mask is giving a very good protection in that such cases. Allergy cases, we have to use so many medicines. So Dashamula Kartraya, Vyagriyadi Kashaya, Shita Jorari Kashaya, and this Lakshmi Vilas Rasa, Mrityunjaya Rasa, all these things are very effective. And night, if possible, take only very light food. Intakanda Gridam plus Talisapatradi Vatakam. Intakanda Gridam with Talisapatradi every day, and no head bath every day, and once in a week only head bath.
Sir, unmute you, sir. Mute
Head application Tudasyadi Thailam or Surasadi Thailam only.
Okay, sir. Okay.
Sir, PCOD with high prolactin level. So please guide what to give PCOD case with high prolactin level.
PCOD cases differs, management differs from individual to individual. A Krisha Deha with PCOD management is different. Stula Deha PCOD different. Hypothyroidism PCOD different. Hyperthyroidism PCOD different. So many cases you are getting thyroid, and even with the normal cases with a strict diet and all this. So we have to see the cases individually. So according to me, in such cases, so Sukumara Yoga is very effective. Sukumara Grida, Sukumara Avaleha is all very effective.
Sir, now fibrosis is common. For young patients also we see lung fibrosis. What we can do?
Lung fibrosis. Lung fibrosis you are asking, no?
Yes, sir. Yes, chronic lung.
Lung fibrosis is nowadays very common after this corona. We are getting so many cases. So in that cases, Lakshmi, the Dashmula Kadatraya Kashaya, okay, we have to give, or Vyagriyadi, and we have to think about Ela Kanadi Yoga. One case, I gave Ela Kanadi Kashaya with Ganthaga 14, morning and evening, and Agastya Rasayana with Rasasindura capsule. It gave very good result. Elakanadi Kashaya. Kotakal Ayurvedishala is having Elakanadi. That too with the Gandhaka 21 or 50, 14. And Agastya Rasayana with the Rasandura is very effective.
Sir, what can we give for to rupture the ovum?
क्या बात सर?
Sir, what can we give for to rupture the ovum?
Rupture?
हाँ.
Rupture होए तो अंग्रेजी देना पड़ेगा शुरू में. वो सब ठीक होने के बाद सेम लाइन ऑफ ट्रीटमेंट देना पड़ेगा.
Sir, treatment
Sir, what is the treatment for plantar psoriasis, sir?
Plantar psoriasis पक्का महादिक्तका गृदा महादिक्तका योगा अय्यपाला तैला and or Majestadi also very effective. Vajragam is also very effective. Very chronic case means Khadira Dashaka Kashaya. Charaka Deshemani Khadira Adi Gana is the Kushtahara Deshemani. That yoga we are Kotakal is manufacturing as a Khadira Dashaka Kashaya. It is very effective.
And locally, sir?
Locally, Ayyapala Kera Taila is effective. Aditya Paka Taila is very effective.
Okay.
Hello, sir. There is a patient of hypothyroidism and she has atrial fibrillation and right bundle branch block. The age of the patient is 69 years. Can we do something in Ayurveda to help this patient in Panchakarma or some medicines?
Don't think about Panchakarma in this case. You cannot do Panchakarma. You can do simple Apyanga only. Other Vamana, Vasti and all, I don't think usable. My Murdu Virechana may be effective. That is normal. Vidaryadi Gana. Vidaryadi Rayam Hridyo. Brahmano. Vadapittaha. Vidaryadi Gana Yoga is very effective in the atrial fibrillation case.
Okay, sir. And she has right bundle branch block also along with this problem. So we can give this Vidaryadi Gana Yoga.
Yeah, Vidaryadi you can try. And Hridayarna Varasa, along with that, Hridayarna Varasa.
I beg your pardon, sir.
Hridayarna Varasa.
And sir, for skin allergies, Sheet Pitta.
Skin allergies, you can all these Eladi Gana, Eladi Kera, Eladi Taila, Ayapala, all these things are very effective.
Thank you so much, sir.
The treatment of sirring, sir, it can be managed with the Ayurveda prognosis.
Which one? Which case?
Sirring. Syringomyelia.
Syringomyelia. Syringomyelia and all very difficult case, madam. Required hospitalization, Nehabala. That also you cannot get a complete cure out of that one. Some relief or improvement will be there, no doubt.
Sir, focal syringomyelia.
Yeah, same line of treatment.
Hello.
Hello, sir.
Good evening, sir. And very good. Melasma, sir.
2-3 people together talking. Only one person take a talk. Please.
The treatment of fungal infection.
Thrombosis and varicose vein.
Varicose vein and all very difficult, madam. There is no complete cure. You can do the Jalukavacharana if you do.
Please ask to last.
Very good result.
Fungal
What about temperatures?
This Valiya Marma Guliga, Karta Guliga paste, if you apply over the varicose vein area, good improvement in the swelling and pain.
Sir, external any application for oil for varicose vein can we give?
Varicose vein, Manjishtadi Taila is very effective. Mahanarayan Taila is very effective.
Yes, sir.
Thank you, sir. Ayyappa Kapala Tela is from Arya Vaidyashala, Kottakkal. Hello?
What, sir?
Ayyappa Kapala Tela is the medicine of Arya Vaidyashala.
Taila is the name of the Taila for psoriasis. Ayyapala Kera Taila.
Whether it is from Arya Vaidyashala?
It is Kottakkal Vaidyashala is having that one.
Okay, thank you, sir.
Treatment about the fungal infection and eczema. Nowadays, the fungal infection is very increasing.
Fungal infection, we have to use always Gandhaka preparations also. That is Aditya Paka Taila, Gandhaka Taila, and Kimshuka Patradi Kera Taila for external application. And the Khadira Dashaka Kashaya, Vajraga Kashaya internally.
And for eczema, sir?
eczema, as I told you, this Aditya Pagataila continuous application is very effective.
Okay, thank you, sir.
Hello, sir.
Yes.
Sir, any treatment for coronary artery block patients if they don't want to go for angioplasty?
Madam, such cases we cannot give an advance guarantee that we are going to open the block.
Correct.
That is the number thing.
Correct.
And if there is a high risk factor in that one, Ayurvedic doctor ने cheat किया ऐसा बोल सकते हैं डॉक्टर लोग patient केस भी हो जाएगा, इसलिए पालक पूरा कन्विंस करके ही ट्रीटमेंट दे रहा है। इसमें एक अच्छा ट्रीटमेंट है रसोनादि कषायम प्लस दशमूलम कषायम, दोनों साथ साथ मिला के प्रभागरवडी morning and evening, and our late PK warriors are used to give. Please hear me. Indukandam Kwadham 1, Gukulutiktaga Kwadham 1, and Hridayarnavarsam 1. All the 3 tablets together twice after food. So all these things are found to be effective, but we cannot assure you, guarantee you that nowadays it's all legal problems are there.
Sir, what can we do for amenorrhea?
Treatment for fibroadenoma.
Fibroadenoma. Fibroadenoma Varanadi is very effective. If it is the size is quite big, we cannot treat. Varanadi with the Kaishora Gulgulu, very effective.
Sir, what can we give for amenorrhea?
Amenorrhea, we so many medicines. Kulathadi yoga, Saptasaram yoga, all these are so many medicines are. Kulathadi kashayam.
So can we use Nilbringadi tail in kids?
In which case?
In children, kids. For the kids.
Yeah. Children we can give Nilbringadi after the age of 5 or 6. Okay. And children we used to give Chambaratya, the Japapushpadi Keram. Chambaratya Keram is there. That is more effective.
Okay, thank you, sir.
Sir, line of treatment in neurofibromas, sir.
Line of treatment in neurofibroma, I told you it is a very difficult case. And we have to start with the Lekhana treatment. Gugulu Tiktaga, Varanadi, and Varanadi Girda. All these things we can give with Kashor Gulgulu. And sometimes this Abhyanga and Kaya Sega, Pirichel, all these things we can give. Still, we cannot expect the good result. So I told you in the beginning, the Gomutra use every day, 50 ml morning and evening, found to be effective in some cases.
Okay,
Sir,
sir.
can we
If a
in both
person
the
is
hands, sir?
suffering deep vein thrombosis.
Madam?
Can we get numbness in both the hands with spondylitis?
Yeah, severe cervical spondylosis, numbness and all these things I told you. Shirobasti is one of the best treatment. You can use Mahamash Taila for Shirobasti, Mahanarayan Taila, Sugandhara Taila, Karpasastyadi Taila for Shirobasti. Internally use Prasaranyadi Kashayam, Shirabala, Indukanta Girdan, Indukanta Girda, all these things.
If a patient is suffering with fibroid uterus and she's having bleeding since 1 month, what should be the line of treatment?
If the fibroid size is quite big, go for the surgery. If the thyroid size is very small, then only you can think about the treatment. In this case, Chandan Oshiradi Kashayam. Kotakal Ayurvedishala is having Chandan Oshiradi Kashayam.
Okay, sir.
Chandra Shurari. Chandra Shuradi Kashayam is for the Udara Krimi. Chandana Ushiradi Kashaya, Chandana, Ushira, etc., which is mentioned in Ashtangadaya Rakta Pitta Chikitsa. That is along with the Praval Bhasma morning and evening, Vrisha Grida in the night. That is very effective in the beginning. Later on, once the bleeding is completely stopped, you can think about the fibroid reducing medicine like Varanadi Gana, Kulutiktaga, Varadi Gana, all these things.
Okay, sir.
Okay.
Pravala Bhasma with Pravala.
Praval Bhasma with the Chandan Ushiradi Kashaya.
Okay, sir. Okay.
Sir, allergic rhinitis
Thank you, sir.
treatment, please.
Allergic rhinitis, I already told sir. Shita Jorari, Dashmula Kartraya, Vyakriyadi Yoga, Agastya Rasayana, Haritakyadi Lekhya, Haridra Khanda, Haridra Marichadi Gana, and Vyoshadi Bataga. All these things according to the condition you have to use. For head application, Tulasyadi Taila and Sorasadi Taila.
Sir, patient is having very common cold from very long time. Then what treatment should be done?
So these medicines only you can repeat according to the condition.
Okay.
And the Anutailam Asya is very effective.
Namaste, sir. Prameha. Namaste, sir. Prameha Rugna with Pakshaghata, Pittavata Prakruti, Sri Rugna, 68 years. What will be the Ayurveda conservative line of treatment, sir?
So in this case, you have to admit the patient in the hospital, Shirodhara with the Taila Shirodhara, and Abhyanga or Kaya Sega, that is the Bhakya Snehana in Swedana you have to give. And another very important medicine in this type of cases is the Naladadi Gridam. Naladadi Gridam, 15 to 20 ml to be taken at bedtime. And Dhanada Nayanadi Kashayam, morning and evening, along with the Surna Muktadi Gudika. And some medicine to control the diabetes also. Along with that, physiotherapy.
Yes.
Basti also can be given after 7 days or 14 days of Abhyanga or Kayasek.
Vitamin D deficiency, sir.
Naladadi Grita.
Naladadi Gridam. Kotakali is having. That is very effective. Okay.
Yeah. Thank you, sir.
Sir, patient is 60-year-old. Cardiologist suggest for permanent pacemaker. His means heart rate is used to low, around 50 to 60.
I don't have much experience in such a type of cases, sir. Sorry. I have not treated any cases.
Vitamin D deficiency, sir.
Vitamin D deficiency, already we told nowadays we are giving C Health 40 and Gandha Taila capsules, all are effective.
Hello, sir.
C Health 40 cortical products.
So ischemic heart disease, how do we have an approach?
System, which one?
Ischemic heart disease, sir.
Ischemic heart disease. Ischemic heart disease also, general heart disease, we have to see. Rasonadi Kashaya is very, very effective. And if the patient is able to digest all the medicine, then only you give ghee and all. Rasonadi Kashayam with the Hridayarnavarasam, Partharishtam with the Prabhakaravati, and every day Lashuna Kshiram. Very effective. Ischemic heart disease.
Thank you,
sir. B12, B6
Good evening, sir.
Good evening.
Good evening, sir.
Good evening.
Sir, I have to ask one question. Many patients are come with the complaints like arm vata, such as morning stiffness, joint pain, but they having a history of chikungunya. So what line of treatment we can use in these cases?
See, it is not only chikungunya, it is dengue nowadays. All these three type of viral infection cases are causing permanent amavastha in the body. Please hire me. Permanent amavastha in the body. So these patients are always suffering from the joint disease according to us amavata avastha. So rukshana is the only treatment in that case. So in that cases, amrutottara kashaya, Murandavadi kashaya, Lakhu Rasnadi Kashaya, Chandra Prabhavati, Kaishor Gulgul, Shadharana Churna. Please remember, Shadharana Churna. Very, very effective to reduce the amavastha. All are very effective. If the hemoglobin level is very less, Purnavadi Mantura tablet are coming nowadays, Patakar. That is also very effective. And regular Virachana with Avipatti or Vilanga Tantulati or Dashmul Haritaki. Sneha Prayoga cannot be done at all. If you do the Sneha Prayoga, the pain increases. So Rucot liniment, pain balm, pain spray, such things are very effective.
Namaskar, sir.
Thank you, sir. Thank you.
Namaskar, sir.
नमस्कार।
हाँ, मैं महाराष्ट्र पुणे से बोल रहा हूँ।
हाँ, बात कर सर।
हाँ, तो मुझे भी ऐसा कुछ अलग काम करने का है। तो
हाँ।
मेरे केरल भी मैं आ रहा हूँ 25 तारीख को।
ओके।
मेरा प्लेन का टिकट हो गया है।
हाँ।
तो मुझे पुणे में ये ऐसा ट्रेनिंग स्कूल चालू करने है। मुझे
हाँ।
मंदार अक्कलकोटकर सर जो है वो
हाँ।
मेरे गुरु है। मेरे को कम से कम 25-30 साल से पहचान दे। मेरे
हाँ।
आके जगह बिगा देख के गए। वो बोले बहुत अच्छा है जगह बिगा, अच्छे एरिया में मेरी जगह है। तो
हाँ।
ये इसमें मुझे मार्गदर्शन चाहिए था और थेरेपिस्ट चाहिए थे। तो
हाँ।
कैसे क्या मुझे सहकार्य मिल जाएगा?
आप तो पता है न्यूज़पेपर में ऐड देना, एक्सपर्ट चाहिए,
ऐड दे दिए।
थेरेपिस्ट चाहिए।
महाराष्ट्र में मैंने ऐड भी दिया लेकिन कोई थेरेपी नहीं आया।
हाँ, केरल में मलयालम में इंग्लिश में ऐड दे दो, आपको मिल जाएगा।
अच्छा,
आजकल
तो
ऐसा
मैं अभी
बहुत ऐड आ रहे हैं
सर
मलयालम न्यूज़पेपर में।
आप कहाँ से हो सर?
मैं कोचिन से।
हाँ, तो मैं कोचिन आ रहा हूँ मैं
आ
25
जाओ,
तारीख को। तो
मिलो।
आपका नंबर ये जो है 100 वो नंबर है क्या आपका?
नहीं 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 नहीं, मेरा कोटेकल का नंबर है। वो हमारे
एक
ये
मिनट।
अभी तो दिखा रहे हैं ना, वो
हाँ, हाँ, हाँ।
उसको कांटेक्ट करो, उसको कांटेक्ट करो, मेरा नंबर मिल जाएगा।
चलेगा
9320848100 कांटेक्ट करो, मेरा नंबर, मेरा एड्रेस मिल जाएगा।
चलेगा। मैं आता हूँ सर 25 तारीख को आपको फोन करता हूँ मैं वहां आने
ओके
के बाद।
ओके।
ओके सर, ओके, धन्यवाद सर, धन्यवाद।
Can you suggest treatment for axillary tail of breast?
What pain? What pain?
Axillary tail of breast.
Tailbone pain, हाँ?
नहीं सर, axillary tail of breast.
Breast pain. अच्छा। Actually, I not treated any case, but we have a product called Yutyadi Thailam and Ashwagandhadi Yambakam. That used to give some muscle relaxation, pain relief. I not treated any such case.
No sir, axillary tail of breast.
Axillary, please explain to me what is the, I first time I am hearing that term. What is the condition? What is the symptoms
Sir,
you are feeling?
in the axillary part, the mass, the continuation of the breast.
That is only muscular pain, no?
No, sir. Sir, pain breast in the continuation, axillary വരുന്നത്. Breast, അതിന്റെ ആ tail develop ചെയ്യുന്നത് pregnancy ടൈമില്. അപ്പൊ ആ മാസിനെ നമ്മൾ reduce ചെയ്യാൻ എന്താ ചെയ്യാ?
അത് ശരി, mass. अच्छा. That for that I told you that karutta guliga, valiyamarma guliga is very effective. That mass, apply that every, or vilwadi guliga is very effective. Vilwadi guliga or karutta guliga, valiyamarma guliga paste is very effective.
Sir, എന്തിലാണ് നമ്മൾ അത് ലേപനം ചെയ്യേണ്ടത്? Medium
with tulsi swarasa.
Okay, sir. Any internal medication?
Internal medicine, Kanchanar Gugulu, Mahatiktaga tablet, very effective.
Okay, sir.
Sir, good evening. Sir, hello, sir.
For duodenal polyp, sir.
Hello, sir.
What, madam?
Duodenal polyp.
Duodenal polyp. Line of treatment is just like Parnam Shula and all. I used to give Kalyana Kshara, Dadimadi Kurda and all these things. And Vidal Veradi Kashaya, in some cases it is found to be effective. Vidal Veradi Kashaya, morning and evening. And Kalyana Kshara also very effective.
कौन सा?
सर, आपका कोई चिकित्सा विशेष बुक है क्या? सर,
Please ask me.
सर, थ्रोम्बोसिस के बारे में बताओ।
किसके बारे में?
डीप वेन थ्रोम्बोसिस।
किसके बारे में?
डीप वेन थ्रोम्बोसिस। DVT।
DVT. Arey madam, it is all very difficult case. Srotorodham, it is very difficult to open such cases. Only miracle can open. I have treated so many cases, very difficult. And
sir, how can we
have treated with the Pipali Vardhamana case. That case showed some result.
सर, आपका कोई चिकित्सा विशेष बुक है क्या? आपका कोई चिकित्सा का बुक है क्या?
Chikitsa Sangraha, Kottakkal Ayurvedishala is publishing one book called Chikitsa Sangraha, available in English, Hindi, and Malayalam.
Okay, thank you, sir. कहाँ available होगा?
माटुंगा में available है.
पुणे में कहाँ available हो सकता है सर?
पुणे में कहाँ पता नहीं है. बॉम्बे में माटुंगा में available है.
अच्छा, पुणे में भी आपका सेंटर है क्या?
एक कोटकल आयुर्वेदशाला ब्रांच.
हाँ, पुणे में है क्या?
पुणे में ब्रांच नहीं है, डीलरशिप है, वो तो फ्रेंचाइजी है. उधर अवेलेबल है तो पता नहीं है.
ओके ओके, थैंक यू सर.
Qualifications के लिए क्या medicine है sir? One leg whitening of hair. Pitting edema in one leg along with pain. Pitting type of edema.
It will be mostly due to the DVT type of symptoms or varicose vein, which is the condition we have to see. Simple Shobha means Purnavadi Kashaya and Chandraprabha is very effective. If it is not working, we have to see the cause. If there is a block or it is Purnavadi Kashaya plus Chandraprabhavadi is very effective for simple Shobha.
Okay, sir.
Hello, sir. What used to prepone the menstrual cycle date? Can we prepone the menstrual cycle date, sir?
Of hair.
I don't know any medicine to prepone or postpone the menstrual cycle. People are saying so many medicine, but I have not tried anything.
Treatment for hair loss and whitening of hair.
That is your field, madam. There are so many oils. Kotakala Ayurvedishala is manufacturing. Always in the female, see the hemoglobin level is low. Start with Annabedi, Loha, Kanta, and according to the tolerance of the oil level, either Kerataila or Tiltaila, Kuntalagadi, Kayanyadi, Tekraj Taila, Bringamalakadi, so many oil. We are masters. Ayurvedishala products are masters in the hair oil. There's 30-40 varieties of hair oils are there. How can I tell one only?
Palpitations के लिए क्या
last 5 minutes, sir.
Sir, hypertension, can you tell me? Sir,
which one?
Hypertension, blood pressure, high blood pressure. Can we use the same medicines of ischemic heart disease?
Mostly same medicine. See, nowadays, this our HT coat, one tablet is there, Kotakal Ayurvedishala product. HT coat is very effective in the BP control.
Yes, sir.
One tablet twice after, that is the normal case. If the maximum 2 tablet also twice after food, it is very effective.
Sir, please repeat the name of the tablet.
HT coat.
Sir, how many times you should take? 2 times?
Normal case, 1 tablet twice after food.
Yes, sir. Yes, sir. Thank you so much.
What is the treatment for bipolar disorder?
Bipolar disorder, we have to study the case. We have to see the dosha assessment. Deha prakriti. Either with this snehapana is required or shamana aushadha is required. Tailadhara, takradhara, all these things we have to see the case, madam.
Palpitations treatment, sir.
What is the treatment?
Which one?
Palpitations treatment.
Palpitation, already I told you. Vidaryadi Gana, Vidaryadi Kashaya, Vidaryadi Da. All these things are quite effective according to my experience.
उसके लिए और treatment क्या है?
Postmenopausal symptoms.
Hello.
Hello, sir. What will be doing?
Hello.
Hello. Sir, I have a patient having problems of hoarseness of voice in endoscopy. That was polyps on larynx.
Which one?
Polyp on larynx.
Excuse me, doctor. Sorry for interrupting. I think we have to stop the session because the time has run more than 1.5 hours. We have been waiting for that, and you have asked a lot of questions. Thank you for that. We will be, you already have the number of Vinayak here. So if you have any more queries, you can directly contact him. He will contact me or Dr. T.M. Unnikrishnan, and you will get the answers. You don't have to worry. And the recording of the sessions will be available. I will send that link to Vinayak. So you can ask Vinayak, he will give that to you. So I am just interfering just because the time constraints. And I think Dr. TMU has explained a maximum, and thank you for that, sir. You have done a wonderful class. A lot of information has been given. In the name of Ayurveda, I thank you. I thank every doctor for coming to this space and asking your doubts. You're just stopping course only because of the time. Again, your questions can be directed towards Vinayak. I will give you the answer. I will ask Dr. TMU, and the answers will reach you, and you will get the information of this session through the recording. You don't have to worry. Okay. So once again,
thank you.
once again, thanks everybody. Thanks Vinayak for arranging this. That's a wonderful session. I am again thanking you in the name of Ayurveda, and I am stopping the session with thank you, sir. Thank you, sir. Once again, I think I can stop, sir. Sir, you have. Okay, sir. Thank you. Thank you, sir.
Thank you, sir.
And write down the Vinayak number is there, 9320-848-100. It is there, so you can just write that down. Okay, everything is there. You can contact Vinayak. Okay. Thank you. I'm stopping the session. Thank you.
Thank you, sir.